Greetings, my name is Dr. Benedict Offor. Welcome to my channel. Today I will talk about what I am currently doing in my postdoc. It's completely different from what I did in my PhD. Here I am studying snake venom proteomics, venomics. What are the components of the snake venoms? What are the clinical implications of snake venoms? What are the effects of these toxins in our body? How does it affect us? Don't go anywhere, stay tuned, pay attention and listen. I bet you are going to learn a lot. There are over 600 venomous snakes across the world. Out of these, around 200 can actually cause death or significant injury to humans. In Africa, for example, there are medically important snakes which are mainly classified as the elapids snakes, the viperids snakes. Snakebite envenomation is a neglected tropical disease that occurs when snakes inject its venom into animals or humans. Mainly in the poor and politically marginalized communities across Asia, across America, across Africa. Globally, there are about 5 million snake bites per annum, which causes about 1.8 to 2.7 million snakebite envenomation, which causes about 81,000 to 138,000 deaths, leaving about 400,000 survivors permanently deformed. In Africa alone, there are about 1 million snake bites per annum, leading to about 100,000 snakebite envenomations and about 10,000 deaths. Snake venom contains a number of components dominated by proteins and peptides. Some of these proteins called toxins include phospholipids A2, three-finger toxins, snake venom metalloproteinases, snake venom serine proteases. Studies have shown intra and interspecies variations among these toxins, which are caused by diet, age, geographical locations, etc. These variations can undermine the efficacy of antivenom used in the treatment of snakebite envenom. The example of viperids include the echis, the bites. Example of elapids includes the mambas and the cobras. So some of this venom can cause local tissue damages, while some of them can be transported systematically through the lymphatic system, through our blood vessels to the target organs in the body. They attack our heart, our kidney, blood platelets. Some attacks the neuromuscular junction, leading to muscle paralysis, bleeding gum, skin necrosis, paralysis of eyelids and eye muscle, oedema. I have searched literatures between 2005 to 2021 to profile the protein of snake venoms of snakes that are medically important in Africa. Example, the elapids and viperids. In the study, we were able to group these toxins into the dominant, the secondary, the minor, and others, depending on the abundance of the protein components in the venom. For example, in viperids, the dominant snake venom toxins include the snake venom metalloproteinases, phospholipids A2, snake venom serine proteases. In fact, the snake venom metalloproteinases made up of 41%, phospholipids A2 17%, snake venom serine proteases 16%. For elapids, the most dominant components include the three-finger toxins, phospholipids A2, and snake venom metalloproteinases. The three-finger toxins made up of 66%, snake venom phospholipids A2 made up of 16%, snake venom metalloproteinases made up of 6%. Interestingly, the three-finger toxins that made up of 66% of the elapids was not detected in the viperids venom. Similarly, the snake venom serine proteases that made up of 16% of the viperids was not detected in the elapids. This is one of the major differences between the viperids and the elapids snake venoms. Amongst other variations, other differences, we further reviewed the snake venom proteomic bottom-up approach, where the snake venom is mixed from the snake and then lyophilized. Lyophilized snake venom is then fractionated using HPLC chromatography. Having done that, the fraction collected from the runs are then analyzed by SDS page electrophoresis, and the fractions subjected to ELISI-MS protein identification, where through database search we'll be able to identify the toxins present in each of the fractions collected from the HBS. From the study so far, we're able to show that in fact the snake protein components of the elapids and the viperids endemic in Africa compared very well with those obtained in other continents, amongst some other variations as a result of the diet they eat, the locations, the temperature. In fact, the data collected from the bottom-up proteomic approach can actually be used in the development of a safer, cheaper, and more effective antivenom that will be used in the treatment of snakebite envenomations within African continent. Also, the data can be used in the production of other therapeutics used in the treatment of cardiovascular diseases, cancer. This study is still ongoing. Stay tuned. I will update you on the progress made so far. In the next video, we will talk about the production of antivenom. Stay tuned, subscribe, share, like this video. Thank you.